हेलो एवरीबॉडी। आई होप आप सब अच्छे होंगे। आई एम जसलीन कौर and I'm one of the registered nurses in UK. And now this video is about NMC OSCE, the station first assessment. Okay, so as I told you in my previous video that OSCE is consisting of like different stations, and one of the 10 station is API. API is the full form of API is includes assessment, planning, implementation, and evaluation. Okay, that 4 station comes under API. Okay, now moving forward towards the assessment. So assessment is basically assessing the patient from head to toe. Okay, it includes the assessment of the airway, breathing, circulation, exposure, and disability. That also A, B, C, D, E. Okay, and the basic thing we have to keep in mind is the safety of the patient. We need to make sure that the patient is safe. We have to follow all the steps in order to make sure the safety of the patient. So as we proceed towards the station, we have to assess the scene safety. We have to tell that the scene is safe to approach, and then I will draw the curtains to provide the privacy and maintain the dignity of the patient. Okay, sometimes in OSCE exam, what happen? The examiner uh, keeps their like specs or hearing aids near to the patient, so we have to use our judgment and ask the patient that whether it's yours or somebody else. If the patient say it's mine, then ask the patient whether you need them, whether you have to wear the specs or you have to wear the hearing aid. If the patient says no, it's fine, then you ask whether you want to keep them here or should I keep them safe in the locker. If the patient say please keep them here, then keep them there only. Okay, we have to consider the things because in order to that is essential for the patient's safety. Next, moving further, we have to do the hand hygiene following the WHO guidelines. Okay, that is palm to palm, back of the palm. Okay, palm to palm, back of the palm, back of the palm, finger interlace, finger interlock, rotation of thumbs, fingertips, rotation of the wrist, and then we have to wash with water. Okay, that we have to do with the soap and water. We have to like verbalize that we do the hand hygiene using the WHO guidelines with soap and water, and after that we will dry our hands for 30 seconds. Okay, then the most important thing is ID check of the patient. We have to check the patient's name, okay, date of birth, hospital number, everything against the patient wristband. We have to verbalize that patient name. Like patient name, for example, is Tom Matthews. Okay, that I'm giving the example. And we have his date of birth is 24th of August 1992, and his hospital number is 12345. We have to verbalize that Tom uh, Tom Matthew, date of birth 24th of August 1992, and check against the wristband 24th of August 1992, and hospital number 12345. We have to like check against the wristband and against the documentation as well. Okay, then we have to check the allergies, whether the patient is allergic to some medications like penicillin or anything. Okay, we have to ask the patient, are you allergic to any drug, food, or anything? Okay, like latex. Then we have to check the allergy band over there. Okay, there it is written like a patient is allergic to penicillin. We have to verbalize that also, and we have to check against the documentation. Yes, it is written that the patient is allergic to penicillin in my documentation. The allergy check is very important because if we in each and every procedure, whether they are API station, API station, whether they are any of the station like IM, subcutaneous, wound assessment, or like dressing, whatever. we have to do these all things in order to make sure the patient is safe. Okay, we have to check the scene in every procedure, in every station. We have to provide the privacy. Okay, we have to do the hand hygiene. We have to check the ID of the patient. Okay, and allergic check, whether it is written the patient is allergic or not in the documentation. We have to make sure the allergy check. Okay, if we forget to do an allergy check in any of the station, we got fail. Then consent, we have to gain the consent of the patient, explain the reason of the station or whatever we are doing. Then next is assessment of the airway. We have to ask the patient or tell the patient, can you please cough or open your mouth. Then we have to assess, or we have to tell that there is no visual obstructions in the airway and the airway is clear. Moving towards the breathing. In breathing, we have to place our hands, both the hands, at the back of the patient. For that, we have to ask the patient that can I place my hands at your back in order to assess your breathing. Then we have to place our hands at the back of the patient and instruct the patient to breathe in and out. Then again we have to place our hands like this, opposite direction, and then again we have to tell the patient breathe in and out. Okay, that complete assessment session is of 20 minutes. Then if there is no abnormal breath sounds, we have to tell that there is no abnormal breath sounds, no respiratory noises. We have to tell complete, no wheezing, no rattles, no striders, and no coughing. There is no unequal air entry, and there is no visual signs of respiratory distress, use of accessory muscles, sweating, cyanosis, and seesaw breathing. We have to learn each and everything in here. Okay, then circulation. In circulation, we have to check blood pressure of the patient using sphygmomanometer. Check the pulse rate, rhythm of the patient for complete 2 minutes. 1 minute for assessing the respiratory rate and rhythm. Then we have to assess the both simultaneously without asking the patient for the respiration. Then we have to say that sorry, I have assessed your respiratory rate without informing you, because if I inform you, that may alter my reading. Okay. Then I give you a tip. When we got the document in front of us, we have to write our name and complete the document. Okay, write our name and date over that. And moving to the next page, there is a chart, news chart. Okay, new early warning system. There we have to write our name of the patient, date of the examination, time, which is mentioned in our documentation, that today's time is this 10 a.m. We have to write 10 a.m. only, not whatever in the clock. Then we have to over the chart there is only little box for the date and time. We have to complete that as well. We have to total the score correctly, and we have to sign also, because if we forget to do that, we uh, got fail. So first of all, you have to complete your name, date, time in advance. Okay, that is the tip. Then assess for the oxygen saturation by applying the oxygen probe. I also advise you that while applying the oxygen saturation probe, first of all, you need to check the capillary refill. Okay, you can say that the finger is clean, there is no sign of a infestation, and there is no nail varnish. And now I'm going to pinch your nail bed for 5 seconds. Can I ask the permission? Okay, so don't worry, it may little hurt you, it is just for the assessment. Then do the pinch for 5 seconds, 1 2 3 4 5. Then release the pinch. Then capillary refill time would be less than 2 seconds. Say that, verbalize each and every step. That is the main thing to pass the skin first attempt. Then assess the perfusion and pallor of the patient while applying the oxygen probe, or checking the pulse or pulse rate. Then we have to tell that the perfusion of the patient is good, that I assessed by uh, touching the patient's hands, that they are warm. And pallor, the patient's extremities are reddish. There is no bluish cyanosis over the lips, over the like face or eyes are not yellowish. So pallor is, the patient is not pale. Okay. Then moving towards the disability. In disability, what the disability is like reflecting the conscious level of the patient. We have to check the conscious level by asking the patient, can I ask you some questions please? Okay, you have to ask the patient, what's the time today, what's the date today, okay, where you are, do you know who I am? Okay, these reflecting the conscious level of the patient by using the alert, confusion, voice, pain, unresponsiveness. Okay, usually the patient is alert because they have to assess your like assessment criteria, and patient can be confused if they are having new like onset of dementia, new confusion. Okay, that you have to mark in your new score. I like basically give you tip, whatever you assess simultaneously you have to document that. Okay, that save your time as well. Then assess the level of the pain by using pain scale. We have to ask the patient that you have, do you have any pain, where is the pain, can you please rate your pain score from the on scale, on the pain scale, where 0 is no pain and 10 is the worst pain. Then the patient will tell that. Okay, document that as well, because that may get a hint for your planning. You that may help you to plan your care plans in planning station. Like you get the hint for the pain, the patient is having pain. Okay, then ask the patient, have you passed urine, to assess the urine output of the patient. Then ask the examiner about the blood glucose. Examiner, can you please tell me about the blood glucose level of the patient? Then examiner will tell you. Moving towards next, the exposure. We have to assess in exposure the temperature of the patient. We have to ask the patient about the presence of bleed, rashes, injuries, bruises over his body. Okay. Then we have to obtain the medical history from the patient. That is all about the airway, breathing, circulation, disability, and exposure. Okay. We have to learn each and everything. And also, I will give you a tip. Whenever you get the like documentation, you have to write your name, date, and time. Okay. In over the new score, do the same. And also, if you got the time, write the hint over the these thing, airway, breathing, circulation. We got that everything over there. In airway we can write what we have to assess, like airway clearance. Okay, breathing we have to write rate rhythm. Also in circulation, that pulse rate and rhythm and abnormal breath sounds, that visual obstruction sign, we can write the hints. Okay, and exposure, in exposure we have to write the assess the temperature, injuries, bruises, and medical history. And disability, we have to assess that like conscious level mean and urine output, glucose level. So we can write the hints over there, the paper we got. Okay, then the holistic assessment, it includes each and everything holistic. By the word itself we know, holistic से ही हमें पता लग जाता है कि it includes each and everything, physical, psychological, social, emotional, everything. Okay, physical, we have to ask the patient, do you have any pain? Okay, do you have any injury? And social history, do you drink, do you smoke, how many like drinks you take in a week? If you smoke, like the patient, if they said I drink that much, okay, I drink like 1 bottle a day, 2 bottle a day, then ask, do you need any like alcohol cessation groups, do you need a referral for that? Okay, then if we ask the patient, do you smoke, if he tell like I smoke like 20 cigarettes a day, then we have to again ask can you do you need a referral to the smoking cessation group? That give you a hint for the planning. Okay, and it also reflects that you are a good nurse, your judgment is good. If the patient say I have a pain, Then don't worry, be relaxed. Please take deep breaths for me now. I have make a note about that. Don't worry. First I complete my assessment. I will let the doctor know, and I also check the medication chart for you. If there is any pain medication prescribed, I will give you that. Okay. Make the patient whatever the concern patient showing during the assessment, we have to address the concerns. Okay. Otherwise, we got fail in the assessment. Then we have to ask the patient, do you have any spiritual needs? We have the chaplain services in the hospital. If you want any like spiritual needs, we will fix your appointment with the chaplain. Then we have to ask the patient, do you have any psychological needs? Do you have any stress or anxiety related to something? Okay, if the patient said yes, then ask the patient, do you need any referral to the psychological help groups? Okay, then that give also a hint to the second problem, that is anxiety related to this disease condition, for the nursing care plan. Is it all right? Then we have to ask the patient, do you have any preference for the male or female carer? Okay, whether they want carer female or male, whatever their preferences are. Okay, write down that. Then give the reassurance to the patient that don't worry, I have documented each and everything, and if you want any further help, we are here only. Here is the call bell. Now I'm going to calculate all of the your new score or whatever the scale it is given, and I will come back after calculating your new score. Side by side you are documenting everything, calculate that. Okay, come back to the patient and tell them about the new score, complete the new score. Okay, we have to do each and everything. If we forgot about the date and time, okay, then we got fail in the examination. Then tell the patient that your new score is 0. Then we will assess you after each and every 12 hours. Okay, if the new score, don't worry that each and every timing the score is given in the examination, that 0 score we have to assess for that time, and we have to do what that is written over there. We have, what we have to do, we have to complete the documentation. We have to write the name, everything, date and time everywhere, and we have to do the initials. Okay, whether we have to refer the patient or not, yes, we have to refer. Always in each and every condition we have to refer the patient. Okay, do we meet the referral? Yes, always yes, in the exam point of view. So thank you so much. I am now ending the video. If you have any doubt, anything you want to ask, please ask free, feel free to ask me. Okay, and please like my video, subscribe my channel. Thank you. If you like my video, subscribe my channel, that give me a motivation to make the videos for you people. Okay, thank you so much. Bye, take care.